Hi, my name is Diana Torres, and this is my sister Karen Torres. She's going to be my audience for today. Today I'm going to talk to you about mumps virus. What causes mumps? Do you have any idea what causes mumps? Okay, well, today I'm going to talk to you about it. Mumps is caused by a virus. This disease was discovered by Ernest William Goodpasture, but first documented in the 15th century BC by a Greek physician named Hippocrates. Mumps can be transmitted by respiratory secretions from a person that is already affected by the condition of mumps. When you get mumps, the virus travels from the respiratory tract to the salivary glands. That's how it starts reproducing. Periostitis is a very well-known sign for mumps. It's either either your salivary glands are going to swell up or the periotid glands below your ear will. Most of the time, people who are infected with mumps have no signs or symptoms when they first get infected. There's a couple of times they're going to have very mild symptoms, but they won't have a clue what's going on with their body. When the signs and symptoms do develop, they usually appear about 2 to 3 weeks after exposure to the virus. These are some of the symptoms you'll get when you have mumps. You'll start feeling sick. You're going to start having a headache, loss of appetite, muscle pain, fever, and you'll start feeling very tired. Complications are very rare, but can be very serious, especially if you get arthritis. Men and teenage boys are most common on getting arthritis. It can cause both or just one of the testicles to swell up. Arthritis can also cause sterility. The structure of mumps virus is a member of the Paramides virus family called the rubella virus. All paramivirus are enveloped particles. These particles consist of what today is known as the ribonucleoprotein complex. The mumps virus genome is a linear and single-stranded molecule of negative sense RNA encased in a nucleocapsid. The nucleocapsid is surrounded by an envelope that is derived from the host cell membrane. There is one stereotype of the virus, and it is in an affected patient. It can be found in most body fluids, including cerebrospinal fluid, saliva, urine, and blood. The virus can be grown in cell cultures and in eggs. The developed layered envelope surrounding the mumps virus is one of the highest contributing factors to its virulence, working through a series of proteins. The main photogenesis of the mumps for toxin obstructing cyon meridians wrestle with the QI and blood stagnation of the ear check. The air temperature toxin from the nose and mouth muscle form in the invasion of the gallbladder meridian of foot. The immune system does not need usual infections to build a robust immune system. Symptoms of an allergic reaction towards the mumps virus vaccine are difficulty in breathing, swallowing, itching, swelling of eyes, face, and unusual tiredness or weakness. Mumps is mostly a mild childhood disease. It mostly affects children between ages 5 and 9 years old, which obviously adults can get infected with mumps as well. When an adult gets infected with mumps, the symptoms are worse and more serious than when a child gets it. You can you can infect another person 6 days after being infected for 9 days after swelling on the neck. Now that we have the mumps vaccine, the number of cases have dropped tremendously, more than 99% in the United States, which means that it is no longer very common here in the United States. But there's a very high risk of exposure to mumps out of the United States. The vaccine is only used in 57% of the countries with more developed economies. In the research I made, blacks are the most common race to get infected with mumps, ages 5 through 19 years old. Outbreaks of mumps still occur, especially in college campus. There's also That's also the reason why everyone who is planning on attending to college has to be vaccinated before they can even get fully enrolled. The significance of this disease on the community is that mumps virus is presented throughout the world. It is presented by airborne droplets released when an infected person sneezes or coughs, and also by direct contact with an infected person. Mumps can be transmitted very easily, especially if you're not vaccinated. There's a very high risk of you getting infected by mumps if you're around someone who has this virus. This is why it is best to get vaccinated against mumps, so you won't have to go through this terrible pain of getting all swollen up from your face. Two current treatment trends commonly used in the management of mumps virus are either taking ibuprofen or acetaminophen. Adults can also use aspirin. Reason why it really isn't recommendable for children to take aspirin is because aspirin has been linked to Reyes syndrome, a rare but potentially life-threatening condition in children. An alternative treatment is the acupressure. The acupressure can be used effectively to relieve pain caused by swollen glands. You can do this by using the middle fingers, gently pressing on the area between the jawbone and the ear for 2 minutes while deeply breathing in. Since mumps is caused by a virus, antibiotics aren't effective at all. Therefore, there is no treatment plan for this disease that includes a pharmacological intervention. Luckily, most children and adults recover from an unchallenging case within about 2 weeks. After a week of being diagnosed with mumps, you can officially return to school or work. You won't have to worry about infecting anyone with mumps anymore. The best way to prevent getting mumps virus is by getting the mumps vaccine, which is known as the MMR vaccine. The MMR vaccine also protects you against measles and rubella. The measles, mumps, rubella injection contains the safest and most effective form of each vaccine. The first vaccine for mumps was used in 1967. It was developed and licensed by Marine Heilemann. 2 doses of the MMR vaccine are recommended before a child enters school. The first one is taken between ages 12 and 16 months. The second between ages 4 and 6 years. If not previously given between 11 to 12, most children receive the mumps vaccine. That's also the reason why there's less cases of younger children getting infected with mumps. If you get mumps when you're pregnant during the first trimester, there's a very high risk of you having a miscarriage. If you're pregnant or plan on getting pregnant for the next 4 weeks, you can get this vaccine. The best thing to do is wait after you give birth to your baby. Now, if you're attending college, work in a hospital, school, or plan to travel overseas, the best decision you could make is getting vaccinated. Getting vaccinated is the best way to prevent getting mumps. Side effects from this vaccine is mild fever, rash, itchy joints for a short time. The itchy joints happens mostly to adults. The mumps vaccine is very effective, and everyone should be vaccinated against this disease. Well, I hope you enjoyed learning about mumps virus.